Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish and have been partnering with the Council on Aging in St. Tammany for over 10 years, mainly as the Caregiver Support Group facilitator each week, and then sometimes as a trainer and educator as I am right now. We have a great topic today, and it's about hearing loss in ear health. And so we will talk about an article from the NIH and specifically the National Institute on Aging that talks about hearing loss. So some of the topics we'll talk about are going to be signs of hearing loss, types of hearing loss, causes of hearing loss, the health effects of hearing loss, how to cope with hearing loss, devices to help, and how to talk to someone about hearing loss. This is a very big important topic, as you'll see by the end of this article. Why it's a good idea for you to stick around for these 14 remaining minutes or so and learning about that. And I hope that if you do learn something from this and you find it helpful, I hope that you will share it with others so that they can benefit from this education as well. Before we get started, excuse me. Before we get started, just a plug for our caregiver support group that I usually do. So we meet on Tuesday evenings from 6 p.m. Central to 7:30 p.m. You stay as long as you want. Most people stay the whole time, but some people they head out after an hour, especially if we're on Zoom. And so the format is we have in-person ones, in-person groups, we have online groups, but we don't have a hybrid group. Like if a in-person group is happening, we're not broadcasting that or having people join electronically. So it's either or. And typically the pattern is the first Tuesday of the month, again at 6 p.m. We're in person at the Slidell Activity Center. The next week, so the second Tuesday of the month, we are on the Zoom platform, and you can join us through your computer. You can join with your smartphone, your tablet. You can even join using a landline phone, and just treat it sort of as a voice or audio conference. So, however you want to join us, whatever you're most comfortable with, please please consider joining us. We have a great group. We have some folks who are there every time. We have some folks who are there once a month. So it just kind of depends. We don't track or bug or anything bug y'all about attendance. You come when you are able to and you would like to. So picking back up with the pattern of the month. So the third Tuesday of the month, we're at the Covington Senior Activity Center. And then the fourth, and sometimes if we get approval for on a fifth Tuesday, we're back on Zoom. So you join us virtually. So I encourage you check it out in whatever modality is most comfortable and easy for you. I know some folks cannot leave their loved one at home. So sometimes they're able to occupy their loved one, get them engaged in some things, and then, they go in the other room or they call from a phone or, they have a conversation with us. And it's confidential. We ask that everybody keep identities private because some people may not want to be known as a caregiver or to know that their loved one needs a caregiver, which I can understand. So we just ask that if you join us, just like everybody else, you keep identities within the group, but then you also do share the lessons that you learned and the resources and tell people about the group. So, all right. Thanks for listening to that commercial. And so we're going to talk about hearing loss, a common problem for older adults. Again, this is an article from the National Institutes on Aging, and I will be sharing a link in the description. Actually, if it's on Facebook, you see a description. If it's on YouTube, we're not able to put a link in the description at this point. But if you look up hearing loss, colon, a common problem for older adults, National Institutes on Aging, National Institute on Aging. You'll find it. All right, and hopefully we'll add that link sometime soon. All right, so if this is your first video with me, I don't read the article. Sometimes it may seem that way, but I don't read the article. I just kind of give highlights of it. So some things verbatim, but some things I just kind of read bullet points, and sometimes I'll add my own commentary and experience to what I'm reading. So thanks for sticking around for this article. All right, so hearing loss, as you may know, is a very common problem caused by loud noise over time, cumulative, aging, disease, and genetic variations. About 1/3 of older adults have hearing loss, and the chance of developing hearing loss increases with age. People with hearing loss may find it hard to have conversations with friends and family. They might have trouble understanding a doctor's advice, responding to warnings, hearing doorbells and alarms, and other important things. And music. It doesn't mention music in here. Music is so important. Most people really love music, and it's an important part of engagement and staying active. So I am an amateur musician, and I certainly want to be hearing music well into my old age. All right, so some people may not want to admit that they have trouble hearing, and hearing problems that are ignored and are untreated can even get worse. If you have a hearing problem, it's important to talk with your doctor. And hearing aids, special training, and certain medications and surgeries are some of the treatments. May not want to do all of them, may not be eligible, or all of them may not help you, but these are some of the options. So, Larry, let's talk about signs of hearing loss. All right, the first one in our six, having trouble understanding what people are saying over the telephone. Finding it hard to follow conversations when two or more people are talking. You often ask people to repeat what they're saying. You need to turn up the television so loud that others complain about it. You have a problem understanding speech because of background noise, not being able to tune that out. Number 5, you think that other people seem to mumble. And the last one is you can't understand what is being said when children and people with higher pitched voices speak with you. And that's the key. The higher pitch voice you're not able to hear, or that frequency you're not able to hear. So, do any of those sound familiar to you? I hope not, but if they do, stick around and we're going to talk about, some solutions and some things. And, hopefully by this, already at this point, you realize how common it is and how it is important to get it checked out. So there are different types of hearing loss. There's sudden hearing loss. There's age-related hearing loss. There's tinnitus. So those are the main three. So sudden deafness may also known as sensorineural hearing loss, is an unexplained rapid loss of hearing. It can happen when a person all at once or over a period of a few days loses their hearing. It can be considered a medical emergency. So you want to let your doctor know as soon as possible. Do not delay. There's age-related hearing loss. Presbycusis comes on gradually as we age. It also runs in families and may occur because of changes in the inner ear and the auditory nerve, which relays signals from the ear to the brain. It may make it hard for persons to tolerate loud sounds or to understand what people are saying. Age-related hearing loss occurs in both ears, affecting them equally. And because the loss is gradual, people with this condition may not realize that they've lost some of their ability to hear. That's why those warning signs or signs of hearing loss are so important. Tinnitus is a common problem in older adults as well. It is typically described as a ringing of the ears, but can also sound like roaring, clicking, hissing, or buzzing. It can come and go. It can be heard in one or both ears. It may be loud or soft. So lots of variation here. This is sometimes, but not always, the first sign of hearing loss in older adults, and it can accompany any of the types of hearing loss that we talked about, any of those three. So this is a symptom, tinnitus that is a symptom, and it's a something as simple as a piece of earwax, could be as simple something as simple as a block of earwax that is in the canal. So it's important to keep that clean. It can also be a sign of other conditions such as high blood pressure and even allergies. This can also be a side effect of certain medications. So you want to make sure you're reading those labels to see if that's been reported in frequency enough for it to make it on the label. Loud noise is one of the most common causes of hearing loss. This could be things that you may not even that seem loud, but you're not really thinking about it at the time. So lawnmowers, um, loud music, all these things over time can lead to permanent hearing loss. It can also contribute to tinnitus, what we talked about, that ringing in the ear. So you want to make sure that you want to do as much as you can to reduce the risk of this type of hearing loss from the loud noises by turning the sound off lower on your devices, moving away from low noise, using earplugs or other types of hearing protection when you're around loud things, whether it be industrial or even loud music. And I would even add to that earbuds. You know, having any type of earbuds in your ears could lead to if it's too loud, then that could lead to hearing loss or hearing damage. So earwax we talked about before, that can be something that can cause a loss in hearing, a temporary one, of course. And if you think this is a problem, just keep your ears clean. And you can even talk to your doctor about solutions or drops to soften the earwax, so you can clean it out more efficiently. A ruptured eardrum could also cause hearing loss. It can be damaged by infection, pressure, or putting objects in the ear, including those cotton-tipped swabs that we use to clean out the earwax. They can actually cause damage if put in too far in. So you want to make sure you're using that properly. Hearing loss can happen from certain medications. These medications are often used to treat infections, cancer, or heart disease. They can also include antibiotics and even aspirin at some dosages. So you want to talk with your doctor about that, and let him know if you're taking something over the counter. Usually they ask that, and they usually know what you're taking, although you want to just make sure they know that they're reviewing your medications every visit. Genetic variations could also cause hearing loss as well. Not all inherited forms of hearing loss are evident at birth. They could show up later in life. Health effects of hearing loss. Hearing loss can affect cognitive health, so how we think, our thinking. Studies show that older adults with hearing loss have a greater risk of developing dementia than others with normal hearing loss, with normal hearing. Cognitive abilities decline faster in adults with hearing loss than with the older adults who have normal rates of hearing. So we're not sure why. There are theories that we don't have time to go into in this, but basically it could be that it's the part of the brain that is affecting the part of the brain that is dying that affects the hearing, the parts of the brain that connect with the ear and hear. It could also be that the hearing loss itself just happens with the ear for the reasons we talked about. And that leads to social isolation, not wanting to be in conversations, avoiding social situations. And that has been shown to be connected with cognitive impairment, with dementia, and things like that. So that's important to, it's important to correct. It's important to correct these things, this hearing loss. So how do we cope with hearing loss? Let your family know that you have a hearing problem. Ask people to face you and to speak louder and to more clearly. Ask them to repeat themselves if needed. Pay attention to what is being said. Pay attention to facial expressions. Let the person that you're talking with, let them know that you're not able to understand what was just said. And then find a good place, a good location, a good place to listen. Place yourself um, between the speaker and sources of noise. So don't let there be something noisy in front of you or off to the side where, it's, if you can get to a better place, try that. The most important thing you do is to seek professional advice. And there are audiologists and hearing aid specialists that can do special tests. So your primary care physician can also test you for hearing, but your audiologist is specially trained in that, and they can talk with you. They can do tests. They can give you options. They can help fit you and tune in hearing aids. So make sure you do that rather than just purchasing something online. Or I would say be careful. I'm not saying not to do that, but exercise some caution, and going to see an audiologist can be very good. It doesn't mean that you have to get a prescription hearing aid. They can be expensive if they're not covered by insurance. But that audiologist should be able to also tell you about over-the-counter hearing aids that may be appropriate for you at whatever stage that you are right now. A cochlear implant is a different type of assisted device that can help people who are profoundly deaf or hard of hearing, whereas hearing aids make sounds louder so that damaged ears can hear it. A cochlear implant actually creates an electric signal that the brain recognizes as a sound. This does require surgical placement and hearing therapy. So talk with your doctor, talk with your family, see if they notice you asking for things to be repeated, or do they notice that you're not paying attention or being able to follow a conversation. Um, so it's important to do that. I hope that you realize that at this point. So we're talking quality of life. We're talking wanting to get hearing corrected so that it doesn't impact your cognition, your thinking, your memory, and your ability to socialize and engage in a conversation. So, all right, y'all. I hope this has been helpful. I'll put a link if we are putting this on Facebook. We'll include a link. And if not, you just need to Google. Let me tell you the title again. Hearing loss, a common problem for older adults. So, all right, y'all. Well, I hope y'all are hearing well. I hope your hearing is spot on. I hope it's great. If not, I hope that you'll check it out. Check out these tips. And I also hope that you protect your hearing. Make sure that you are, watching how close you are to the speakers at a concert if it's really loud, even if it's outdoors. It doesn't seem harmless. And I hope that if you're using the lawnmower or other loud equipment, the we didn't mention it before, but like the blower, a lawn blower, these things kind of add up over time. I try to do this myself. Most times I am. If most times I do have something. I do have hearing protection when I'm cutting the grass and things like that. So it's just not worth it. All right, y'all. Take care, and I will see you on the next Caregiver Coffee.